the Permanency Innovations Initiative, PII, a new way to work in child welfare. One of the greatest challenges in child welfare is our most vulnerable children and youth who remain in foster care the longest. The Permanency Innovations Initiative, or PII, a 5-year presidential initiative, responded to this need, but not by doing what has always been done. PII includes 6 grantees working to solve different challenges related to long-term foster care using a common strategy. The grantees, Arizona Department of Economic Security, California Department of Social Services, CAP, Illinois Department of Children and Family Services, Los Angeles LGBT Center, RISE, University of Kansas, KIP, and Washoe County, Nevada Department of Social Services, knew that subpopulations in their systems have disproportionately longer lengths of stay in foster care. These groups include Native American and African American children, lesbian, gay, bisexual, transgender, and questioning youth, children with severe emotional disturbances, and children affected by trauma.
Many children will enter foster care and will exit foster care, but for a small minority of young people, the system is not providing the outcomes that we want. They are not exiting into permanency. This is a fundamental failure of the child welfare system.
PII grantees have gone on a learning journey. The PII Approach offers a new way to examine challenges facing children and families in the child welfare system and test solutions. The PII Approach is distinguished by the integration of implementation science and evaluation research into a comprehensive approach.
The PII Approach is very unique among other implementation experiences that I've had for a number of reasons. Integration of evaluation from the very beginning is something that I think is an ideal arrangement for implementing any innovation. But also the robust technical assistance that we receive, and probably most notably, the conceptualization of implementation through the lens of implementation science.
It's really the staged approach that is most significant in allowing people the opportunity to collect data, begin implementing early with a smaller group of participants and collect data, see how that goes, because there's going to be those unanticipated obstacles. Because of that staged approach and this kind of more careful systematic planning, what I think it creates is the opportunity to have not only more stable implementations, but more replicable implementations and interventions. So then we can take what we learn and hopefully use it in other communities.
What has been learned from PII is a new way to plan for and approach the journey. The PII approach means a more deliberate way of working, yet many in child welfare feel they cannot slow down because of pressing issues with much at stake.
Sometimes in child welfare, because of the crisis mode that we're in, we feel like we have to make a decision really quickly. But when we do that, we aren't exploring all the possibilities. So what PII allowed us to do was take a moment to just be in that exploration mode.
Child welfare is a very fast-paced, crisis-oriented process. And it is very difficult to slow down. There's a lot of tensions within community, within agencies, within systems of hurry up, hurry up, hurry up. So I think the best way to have the system slow down was really through communication and relationship building.
In the PII journey, toll gates were used as mile markers to assess progress.
Toll gates really serve a valuable function. It brings together the decision makers to see how things are going, whether things are moving in the right direction, and whether you should proceed in the same direction or whether you need to adjust and move in a slightly different direction, or if conditions really demand it, to stop and to start over in a more deliberate way that is going to allow you to sort of redirect your resources.
PII is creating a new way of working in child welfare. We are learning that it is important to slow down and take the right steps at the right time.
The PII approach required us to be more systemic. We have never implemented a process previously that evaluated a model, that studied it, that implemented, that went back and tweaked it. And what I've noticed since the research component has been over is that there have been times that we just want to implement something that is large scale without using the rigor of the PII approach, and we realize that we can't do that because the PII methodology requires you to be very disciplined.
With the PII journey, we are moving in the right direction. The PII approach means a more deliberate way of working, yet many in child welfare feel they cannot slow down because of pressing issues with much at stake. As always, the journey is just as important as the destination.
The Children's Bureau has been very intentional about putting an increased emphasis on evidence building in its grant making, requiring grantees to rigorously evaluate their programs and disseminate those findings effectively to the field.
Our team created a 5-volume PDF guide that can also support the development and implementation of interventions. The evaluation team has created several briefs and provided materials that would be very valuable to other evaluators who are trying to either use child welfare administrative data or trying to use this approach for evaluation, and helping them think through data mining and think through other key work that was conducted with the PII grantees. There have been multiple resources that have been created to support the field and other human services as well to try to use this approach.
Change is not easy, but these guidance tools and manuals can help. Resources are also available from the Children's Bureau's Capacity Building Collaborative. For more information about PII, visit the Children's Bureau website at www.acf.hhs.gov/cb. This video was created under JBS International Incorporated. Contract number HHSP 23320095638WC. Funded by the Children's Bureau, Administration for Children and Families, U.S. Department of Health and Human Services. The views expressed in this video do not necessarily reflect the views or policies of the Children's Bureau, the Office of Planning, Research and Evaluation, the Administration for Children and Families, or the U.S. Department of Health and Human Services.